Hello, I'm Raymond Cross from the University of Maryland School of Medicine, and I'm here to talk to you today about Methotrexate, which is a medication that your doctor prescribed for treatment of your Crohn's. So Methotrexate is classified as an immune suppressant. It can be given in pill form or an injectable form, and it's typically given once a week. It can be used as primary or add-on therapy for your Crohn's disease. It can also be used to prevent antibody formation if you're on a certain class of drugs called anti-TNF therapy. And we find that it can work really well for arthritis associated with Crohn's and colitis. So it may be used in oral form for that reason. The most common side effects of methotrexate happen early when you first start taking therapy, and it includes nausea and fatigue. We can often work around those side effects by having you, for example, take your dose in the evening before you go to bed. In the case of fatigue, you will be taking a folic acid supplement each day while you're on this medication to prevent anemia, but we can increase that dose around the time of your either oral medication taking or injectable to decrease side effects. Some other side effects that we can see, occasionally patients can have photosensitivity, so they can have a reaction to the sunlight. Particularly in our women patients, we've noticed it can cause some thinning of the hair, so we have to be particularly aware of that potential problem. It probably doesn't increase your risk of any type of serious infection, but it does increase your risk of non-melanoma skin cancer very slightly. So it's important, if you're taking this medication, do you take protective measures to avoid excess sun exposure? So use sunscreen, wear a big hat if you're going to be outside, long sleeves, those SPF long sleeve shirts if you're going to be out in the sun for a prolonged period of time, and periodically see a dermatologist for skin cancer screening. One of the other potential side effects of methotrexate use, which is typically uncommon, is abnormal liver enzymes. So we do recommend that when you first start taking this medication, that you check your labs fairly frequently. At our institution, we recommend labs monthly for 4 straight months, and then we recommend every 3 months indefinitely. In fact, we won't prescribe more than 90 days of therapy, just as a reminder both to you and to your provider that you need your labs checked before you get a refill. We also recommend that patients drink no more than 3 alcoholic beverages per week while they're taking methotrexate. Now, one other thing that our women patients need to know is that this drug can cause abortions and it can cause birth defects. So you cannot take this drug if you're trying to conceive. In fact, we recommend that you use at least one highly effective form of birth control while you're taking the therapy. If you do desire to become pregnant, you need to meet with your doctor and talk about a strategy to eliminate the drug. Typically, we have patients hold the drug for at least 90 days before they attempt to conceive. So hopefully this has been educational for you and you'll have an excellent response to your methotrexate.